Together, we can.
Together, we can.
Together, we can.
Together, we can save lives. Please get to our research projects. Visit kidneycancercanada.ca.
And I have a patient that is here that is going to share her story. Her name is Heather, and Heather is a middle-aged mom of two, and she's been a KCC member since 2008. And she was first diagnosed with a very large clear cell renal cell carcinoma in March 2008. And there is a video of her speech, but I'm sure that she will, that she gave in 2008, was it? There, about 2010. But I'm going to let Heather tell you her story and the interesting challenges she's faced since her first diagnosis.
Hi, my name's Heather Corbett, and I have been a member of KCC for 9.5 or so years. I was always regular with my physicals. I think that's a very important thing to do. September 2007 went for my physical, and I had a cold, so my doctor said, because I'm type 2 diabetic as well, she said, hold off on doing your blood work because it can throw off your numbers. Wait till your cold is gone. So I waited too long probably, and I waited till December, went for my blood work. I got a call from my family doctor. She's fantastic. She called me herself, and she said, you know, your hemoglobin is pretty low, and I'm concerned, so I would like you to take some iron and repeat it in a week. My hemoglobin dropped the next week down to 80. Hemoglobin levels are normal between 120 and 160. My hemoglobin was 80. So, you know, she asked me the usual, being that I was 42 at the time, you know, are you having excessive bleeding? How are your periods? All of these questions. And the only thing I could come up with was that I'd had a cold and I was tired, but I just started a new job and on my feet a lot and a lot of learning, so I accredited it to that. So she said, it's not normal. We have to figure out why your hemoglobin's low. So she was very persistent, as she always is. And she sent me for ultrasounds, a battery of tests, and nothing came back. So she sent me to a hematologist, and he sent me for more tests. I had a bone marrow biopsy even. I didn't like that too much. And that also came back normal. So while I was getting results for these tests, my family had said, you know, you still have a naggy cough from that cold in December, and now we're the middle of February. So when I was getting results from my GP by phone one day, I said to her, you know, I still have this ridiculous little naggy cough. And she said, I'll send you for a chest x-ray. And I said, well, we already did that. So she decided to send me for a chest CT. I had the CT done, and I didn't even make it back to my office, which is 20 minutes away. And she called me to tell me that there was some necrosis, which is basically dead tissue showing at the very bottom of the chest CT. And they wanted to do an abdominal CT, and that was set up for the next day. So I went back the next day, had another CT, made it back to the office, and got a call from my doctor's receptionist. I used to work in doctor's office, and I know that's not necessarily a good thing, especially since she usually calls me herself with anything. And the receptionist asked me to come to the office that day, at the end of day, and bring my husband. So I knew that she was going to tell me I had cancer, because I knew that's what they were looking for. I just didn't know of what. So when I arrived at the doctor's office, she didn't really make eye contact, which was not a good sign. And she said, you have a mass on your kidney, on your left kidney. And I said, you mean a tumor, you mean cancer? And she said, yes. And she had already booked me for my urologist appointment the next day. She did say that if you're going to get cancer, kidney cancer is the one to have, because it was completely encapsulated, and they could probably just take out my kidney, and I might not ever even have to have chemo. So I went home and did my research and looked up a list of questions. I think I got some questions actually off of Kidney Cancer Canada, what to ask your urologist. So I went with my list of questions to Dr. Spodek at Centenary, wonderful man, and I took laparoscopic surgery off of the list of questions when he told me the tumor was 15 centimeters or so. So I knew then that I was dealing with more than I thought, but again, he thought it was encapsulated within the kidney. It didn't appear to be spread anywhere. So he explained the surgery would be a left open radical nephrectomy, which is basically an incision through your side. They remove a rib and they remove your kidney. He called me back a few days later to tell me that they'd like to do, I'd have to do a blood transfusion. My hemoglobin was dropping too quickly and he'd like to do a transfusion prior to surgery. And he also told me that he would like to embolize, hope I'm using my right terminology, my kidney, which would be to block the blood flow to the kidney prior to surgery to reduce the blood loss. So that kind of unnerved me. That was the first time I was really upset, actually. I didn't want to have that done, particularly while I was awake, because that seemed like it might be painful. But I was fascinated by medicine, so we were scheduled, March break was in the middle, and you can't have elective surgery during March break. So I was delayed by a week into surgery. March 17th, I went into hospital and had my transfusion, which was kind of weird. It's odd to me to be, and I'd had lots of surgeries and things, but I'd never had a transfusion, and having blood flow into you is kind of weird. I kept thinking, I wonder if this person's athletic and I'll get inspired to start running or something. So I had my transfusion that night, and the next morning they wheeled me down to surgical radiology. Very nice man again, wonderful people, and they make an incision at the top of your leg, at your groin, and they insert these thin but very long wires up inside the artery, I guess it is, and they pass current, and you hear this little noise, and I can see it on the screen, and it makes a little coil. It was quite fascinating, actually, and this is supposed to block the blood flow, and then they would take me to surgery. Well, the first wire didn't work, the second wire didn't work, the fifth wire didn't work, and now they're running out of wires. 11 wires later, it finally blocks off the blood flow. And he offers me some pain meds, and I said, it's really just a mild cramping, it's not a big deal. So they wheeled me out. My surgeon wasn't ready, he was delayed in surgery. So they wheeled me out into recovery room to wait for my surgery. And it turned into a bit longer of a wait than should have been, and the pain got excruciating as the kidney, I guess, is beginning to die. So they take me eventually into surgery, and of course, I'm asleep, so I don't know, but I do have my, I have all my reports. I have the surgical report. They removed a big part of one rib. They removed my kidney with tumor, some lymph nodes, which were clear, and the adrenal glands. So stapled me up, and up to recovery I go. When I woke up, I remember being calm and relaxed and glad that it was over, but in a bit of pain. I had pain management pump, spinal, which was a big decision for me to make, which type of pain relief that they offer you. But my doctor pretty much insisted that this was the best way to go. And that worked really well for pain management. You administer it yourself at the push of a button, basically, but there's of course a maximum. But I was having a little bit difficulty breathing, and when the nurse came in to take my vitals, you know, I'd say to her, I don't know if this is right. I feel like I'm having trouble breathing. And she said, oh, you've had major surgery. You know, you're basically cut in half and you're on morphine. Of course you're feeling that way. So next shift change, a couple of times I'd fallen asleep and I wake up gasping for air. So next shift change of nurses, and I again said to the next nurse, I feel like I'm not breathing. When I fall asleep, I feel like my heart is stopping and I'm not breathing. So she checked my vitals again. They were all normal. The third nurse comes in, and I'm now desperate because I'm sure that when I fall asleep, I'm stopping breathing, to the point where I've told my husband not to leave the room and to watch me breathe while I sleep so I can get some rest. So that nurse decided to hook me up and leave the oxygen monitor and the heart monitor on while I was sleeping. And next thing I know, I wake up and she's ordered a chest x-ray in my room, an ECG, to my room, which, because my heart rate dropped to 26 beats per minute, and I don't remember what my oxygen level was, but it wasn't good. So after those tests, they knew something was wrong, and they sent me downstairs for an emergency CT scan. It was a Sunday, and they had to call the radiologist in. So he ran the scan and showed my lungs were full of blood clots, pulmonary embolisms. And so at that point, the results came in. I was back in my room, and I could hear the nurse saying, calling for transport to send me down to CCU. And I remember distinctly, because the station was right outside my door, she said, no, she can't go in a chair, she could crash in the hall. So now I'm totally terrified, and down to CCU I go to be in my glass room where everybody can see me and watch me. So that was actually reassuring that I was being watched carefully, and I started blood thinners because of the blood clots. And my 5 to 6 day stay in hospital turned into 13 days, and then I was finally released to go home. On follow-up with my urologist, my surgeon, he told me that I had a 15 centimeter stage 3B. I had no lymph node involvement and no metastases. So he suggested that I go to Princess Margaret Hospital. There was a study, I think it was for Sutent at the time. At that time they were studying to see whether that prevented kidney cancer from returning. So I was desperate to be on that study. I wanted in on it really bad, and he referred me down to Princess Margaret, and I saw Jennifer Knox. Before I saw Jennifer, I met with Deb Maskins, who was in the paper. That's how I connected with her. She was in the paper trying to get some treatment in the States, or a test in the States, I don't recall. It was back in 2010 maybe, or 2008 I guess it was. So she met with me before I went up to see Dr. Knox for the study, and she said to me, you know, Heather, don't be upset if you don't get into the study, because there's always another study, and if you're not on one study, if your kidney cancer ever comes back, then you're available, and you know, you can get into the latest and greatest study, because now you're first-line treatment. If you've had a study before, you wouldn't qualify. So I thought that was a good idea, but at the same time I was really afraid of it coming back, and I wanted to be on the study. And when I went upstairs to see the doctor, she told me I don't qualify because I had the blood clots in my lungs. So the decision was made for me, and I was followed at Princess Margaret. First, you know, you go a month after, 3 months after, 6 months, 9 months, and so on. I think it was 2 or 3 years into my surveillance at Princess Margaret, and I went with my mother to her GP because she had osteoporosis. And I read all the reports, even if I don't understand half of it. And I asked her, doctor, could I see her results of these scans and x-rays she'd had? And I was flipping through as she was speaking with my mom. And at the bottom of one of the reports, it said that she had a incidental finding of a mass on her kidney that should be followed by ultrasound. And the doctor didn't even raise that with my mom. And I asked her about it, and she said, oh, that's nothing to be worried about. But I pushed the issue, and I said, no, I am going to worry about it because I've had kidney cancer and it should be looked at. So after she had some more testing, it was found to be kidney cancer, and I got her in at Princess Margaret from Sarnia. And I got her into a good surgeon there, and she had just the bottom of her kidney removed, and she was just followed with ultrasound. So she didn't have to have any chemo or CTs even. It was stage 1 or 2, I don't remember. So because of that as well, there's a connection. I was very young when I had my kidney cancer, statistically for kidney cancer, and because of my mom having it, I asked to be referred to a genetic specialist, and I'd never even thought of that other than at one of the Kidney Cancer Canada conferences there was a geneticist there who did a talk, and I thought I should see if I should look into that. So he, actually it was a she at that time, did some tests, and I go back regularly. Every couple of years they find new things that they should have a look at. I've just been checked again. So that puts us about 3 years after. I think the hardest part at this point is, especially early on, I'm waiting for the axe to fall. Is it going to come back? Oh, I have a cough. Oh, this is the same. You know, I have an ache of pain. Is it back? You're always, first thing you think of in the morning to the last thing you think of at night is it going to come back? I studied kidney cancer every day on the computer. I wanted medical journals. I wanted facts. You know, does anybody else have kidney cancer that stage? How long did they live? Did it come back? Did they survive fine? I wanted statistics. And then I decided, you know, I was keeping up with Kidney Cancer Canada as well, but I decided I needed to go back to work to be normal, because otherwise kidney cancer's one. If it changes your life that badly, that you're obsessed, then you're not living anyways. So I went back to work at 10 weeks after surgery, and I still kept up, and it never goes away. Time passes, and it's not the first thing on your mind in the morning, and not the last thing at bedtime, and you don't think every cold and ache and pain is cancer. I got to 4 years. I went for my 4-year CT scan, and it was clear. But a few days prior to that, my GP called me after my physical and said, guess what? Your hemoglobin's down again. So it was at 88, and that was in May, I guess, of 2012. And so I said, oh, here we go again. So back for ultrasounds, abdominal ultrasounds, blood work, and she did a stool test and found blood. So I had a colonoscopy, that was clear. I had a barium x-ray, and I don't know what it is with barium x-rays, but they have the best looking male technicians do that job for you. And if you have no idea what a barium x-ray is, look it up. It's not something you want to do in front of a good looking young male technologist. So that came back clear as well. So my GP is stumped, and she sends me down to St. Mike's because there has to be some kind of bleeding in my digestive system to have blood in my stool. So I go down to St. Michael's Hospital to a specialist there who does, and I think he's like one of only one in Ontario that does this test, and you have a capsule endoscopy. So it's a very large capsule, and it has a little camera inside, and they activate it, and you swallow it after you've done your evening prep the day before to clean you out. And you swallow this capsule, and you wear a receiver, and it takes pictures every second all the way through your digestive system. And they found a walnut-sized mass in my small intestine. And I said to him, well, so do you think it's kidney cancer come back to my small bowel? And he said, no, I'm about to retire, and I have never had anybody with kidney cancer as a mass in their bowel. That's not the place, you know, kidney cancer doesn't go to your bowels. I said, okay, so we'll figure out what it is. So we've got something new to do. So scheduled for surgery with the surgeon at St. Mike's, and they did a vertical incision. He removed the mass and stitches the small bowel back together. You have 20 feet of small bowel, so losing a foot or so is no big deal. And they stitched me back up, and off it went to pathology. And the surgeon said, I know the pathologist that's working, and I'll get an answer for you this weekend, and I'll call you. And I was in hospital for 5 days that time, and let me tell you, I had my clothes on, I was showered and ready to go. At the door, I was not extending this stay. So I was at home, waiting, never heard, and then finally the Tuesday I get a phone call, and I get out my pen because I know he's going to tell me I have some weird disease, and I'm going to have to write it down to research it. And he says, it's kidney cancer. You have renal cell carcinoma metastases. So I didn't have to write that down. I knew what that was. But because it's already removed, can't do chemo, can't do radiation, it's gone. So it's just a case of following. So back again I go to the 3, 6, 9 months business. So again, still being followed at Princess Margaret. I should be glowing in the dark. I've had so many CTs. That was 5 years ago. So I'm 5 years since my second cancer and 9 and a bit years since my first. I think the hardest part, for me, I'm a strong person, and I'm always the other one helping everybody else out, but I think I didn't want to show my family that it was worrying me. So you don't want to, even though I talked about it all the time, I didn't talk about how scared I was. And I think that Kidney Cancer Canada solved that issue for me, because they weren't my family. Me telling them how worried I wasn't going to stress them like it would my family. So I found that that was a huge support. Plus the knowledge. I had no idea what I was looking at, what I was facing. And frankly, when you look statistics up, that is terrifying. I should have been dead 10 years ago, or 5 years ago. So don't look at the statistics. We're all breathing. It's, curable. Everybody's different. My story, don't let it scare you, because some people have tiny masses, like my mother. It's removed. Follow up with ultrasound, no big deal. Some are worse, obviously, but every case is different. My biggest point is get support when you need it. If you need counseling, even Kidney Cancer Canada can refer you to good people that you can speak to. or if you want another patient to speak to, just to voice your concerns, absolutely, people are there for you. Ask questions. If you feel something's not right, speak up. You have to advocate for yourself. You're the only person that knows your body. And other than that, we're here for you.